HIPAA compliance checklists, supporting good faith compliance efforts. Complying with the Health Insurance Portability and Accountability Act, or HIPAA, is important for organizations with a responsibility for the privacy and security of protected health information, because non-compliance can result in a loss of patient trust, healthcare fraud, and regulatory penalties. To support good faith compliance efforts, covered entities and business associates can take advantage of HIPAA compliance checklists. However, as there is no one-size-fits-all checklist, we have compiled a general checklist based on the 7 fundamental elements of an effective compliance program. The 7 fundamental elements were published by HHS Office of the Inspector General and assume risk assessments have already been completed to identify vulnerabilities and threats to compliance. HIPAA General Compliance Checklist. Develop policies and procedures that support compliance with the privacy rule and ensure technologies are configured to comply with the security rule. Designate a privacy officer and a security officer, and build a compliance team around them where possible. Implement effective training programs, emphasizing continuous education rather than one-off training sessions. Establish communication channels for notifying compliance officers of complaints, violations, and breaches. Monitor compliance and workplace policies to prevent poor compliance practices becoming the norm. Enforce workforce sanctions fairly, equally, and visibly. Respond promptly to reported complaints, violations, and breaches. Determining applicable compliance standards. The applicability clause of HIPAA states organizations are required to comply with the HIPAA regulations, standards, and implementation specifications that apply to their activities. Therefore, different organizations have different compliance requirements. Most health plans, healthcare clearinghouses, and healthcare providers must comply with the administrative requirements, the privacy rule, the security rule, and the breach notification rule. Other organizations may only need to comply with the security rule and/or breach notification rule. Compliance requirements can also vary within larger organizations, necessitating department-specific checklists. For this reason, we have described several types of HIPAA compliance checklists that may be of value to HIPAA-regulated organizations, starting with a HIPAA Risk Assessment Checklist. HIPAA Risk Assessment Checklist. A HIPAA Risk Assessment Checklist is the foundation of all compliance efforts. Key steps include identifying where and how protected health information is created, received, stored, and transmitted, assessing threats to the privacy and security of protected health information, evaluating existing policies and measures, implementing necessary changes, and documenting findings. HIPAA compliance checklists for specific areas. Organizations can develop situation-specific checklists based on their activities. For example, public-facing healthcare facilities should focus on policies related to patients' rights and permissible uses of protected health information. These policies may include procedures for distributing privacy notices, obtaining authorizations, managing access requests, and establishing complaint reporting procedures. Additional HIPAA checklists. Organizations should consider creating additional HIPAA checklists for training, breach notifications, and IT security. A training checklist should aim to ensure members of the workforce understand HIPAA, while a breach notification checklist guides appropriate actions following an impermissible use or disclosure, and an IT security checklist covers the implementation specifications of the security rule. HIPAA Compliance Audit Checklist. The HIPAA Audit Protocol published by HHS outlines areas investigated by the Office for Civil Rights during an audit or compliance investigation. Common areas to consider in a HIPAA compliance audit checklist include notices of privacy practices, individuals' access rights, documentation, training, and compliance with the breach notification rule. Organizations should be alert to changes to the HIPAA audit protocol and amend checklists accordingly. Regular review of HIPAA compliance checklists. As threats evolve and HIPAA regulations change, it is important to review HIPAA compliance checklists regularly. Although HIPAA does not mandate regular reviews, it is a best practice to schedule annual reviews and update checklists in response to material changes in the HIPAA requirements. Because there is no one-size-fits-all HIPAA compliance checklist, organizations that wish to demonstrate good faith compliance efforts may need to develop multiple HIPAA checklists. Depending on the nature and scale of an organization's activities, this can be a complicated and time-consuming process. Therefore, in many cases, it can be beneficial to seek assistance from a HIPAA compliance expert.